for release of this book.
Ministry of Ayush acknowledges the efforts of Dr. BCS Rao, Assistant Director, Ayurveda CCRAS, Dr. Avinash Chen,
Dr. Ashwin Chandra, Dr. Amit Rai, Dr. Sophia Jamila, Dr. Asim Ahmed, and Dr. Dheeraj Devnath for compilation of this booklet. Thank you, sir. Now I request Honorable Minister of Ayush and Honorable Minister of Port, Shipping and Waterways, Shri Sarbanand Sonowal ji, for his presidential address.
Namaskar. Today, we are all happy to be associated to each other in the spirit of brotherhood, and we are here to promote the principle of humanity. Respected Union Minister for Ayush, Dr. Manjupara Mahendra Bhai, respected Secretary, Ministry of Ayush, Padma Shri Vaidya Radish Katisha ji, official from the Ministry of Ayush and Ministry of External Affairs, respected delegate from ASEAN member countries, and all the distinguished speaker, expert, practitioners, official, and industry partners. It is with great pleasure that I address this esteemed gathering at the India ASEAN Conference on Traditional Medicine, representing a nation that deeply values the power and potential of traditional medicine. India's relation with the associations of Southeast Asian nations have a long and significant historical background rooted in cultural, economic ties that date back to more than 2 millennia. Historical records revealed that Indian traders, especially from the southern region, embarked on maritime expedition and establish trade link with various kingdoms in the ASEAN region. These exchanges led to the spread of Indian culture, including religion, art, language, and science. Magnificent structures at historical sites such as Angkor Temple Complex in Cambodia's northern province of Siem Reap, the ancient Candis in Kedah in Malaysia, and the Borobudur and Prambanan temples near Yogyakarta in Indonesia are, in fact, evidences of India's early linkages and its influence on Southeast Asian nations. India and ASEAN together form total 7,787 million square kilometer, accounting to just over 15% of total land size of the world. India and ASEAN, with their combined population of over 2 billion, account for about 30% of the global population. The combined GDP of India and ASEAN is estimated to be $7.41 trillion for the year 2023. ASEAN is India's fourth largest trading partner, accounting for 10% of India's total trade. This enumerates the huge potential for trade and development in the sector. Honorable Prime Minister of India, Sri Narendra Modi ji, at the 12th ASEAN-India Summit at Myanmar in November 2014, enunciated Act East policy, giving a new momentum to the strategic partnership. The Act East policy emphasizes connectivity, commerce, and culture. That is 3 C's as the focus area of action for a greater ASEAN-India integration. Last year, that is 2022, India-ASEAN celebrated 30 years of friendship. The traditional medicine sector has potential to fulfill all the 3 C's. India and the ASEAN nations share a rich heritage of traditional medicine system that have been nurtured and practiced for centuries. They are blessed with rich biodiversity and have a lot of similarity in the flora, which has also found place in their traditional diet. Our collective wisdom in this field encompasses deep-rooted system of traditional medicines like Jamu medicine of Indonesia, Malay medicine practiced in the region with Malay communities, including in Malaysia, Indonesia, Singapore, Myanmar traditional medicine, Thai traditional medicine of Thailand, and Vietnamese traditional medicine. Indian traditional system, popularly known as Ayush, system of medicine consisting of Ayurveda, Yoga and Naturopathy, Unani, Siddha, Soharikpa, and Homeopathy, which are well integrated into healthcare delivery system of the country. Under the visionary leadership of Prime Minister Sri Narendra Modi ji, Ministry of Ayush, through its various policy initiatives, strategies, and action, is strengthening, promoting, mainstreaming the Ayush system of medicine in accordance with the global context and national priorities from grassroots level. A robust ecosystem for Ayush is being developed by creating benchmark standard for education, research, product, practices, practitioners of Indian traditional system of medicine for achieving the sustainable development goals and universal health coverage. Ladies and gentlemen, regulatory reforms brought in the Ayush medical education sector over the last 9 years have transformed this sector, bringing in transparency, meritocracy, and expansion. The statutory bodies, National Commission for Indian System of Medicine, National Commission for Homeopathy, have been established to regulate the standard of education, teaching, training, recognition of degrees, and practice of Indian system of medicine and homeopathy. Institute of Teaching and Research in Ayurveda is the first and only institution with institute of national importance in Ayush sector. This has taken Ayurveda education to a new height. National Institute of Ayurveda was conferred the deemed to be university status under de novo category and was dedicated to the nation by the Honorable Prime Minister of India, Sri Narendra Modi ji, on 13th November 2020. The first ever All India Institute of Ayurveda set up to bring synergy between the traditional wisdom of Ayurveda and modern diagnostic tools and technology. It is bridging the gaps in the scientific information about quality, safety, efficacy of Ayurveda product and developing standard for Ayurvedic education, research and healthcare services. The Global Center for Traditional Medicine of World Health Organization being set up at Jamnagar with the support of India will help member countries in taking enabling steps in their respective countries for strengthening education practices of traditional medicine. It can act as a force multiplier in each member state in providing an access to safe, effective, low-cost coverage for promotion of health and prevention of diseases in all member states. Yoga symbolizes the union of body, mind and consciousness. Today, it is practiced in various forms around the world and continues to grow in popularity. The International Day of Yoga is celebrated every year on 21st June with great enthusiasm worldwide. Yoga has immense potential in providing stability to body and mind. To bring in wider outreach and practice of yoga, Ministry of Ayush had launched apps, that is WHO M Yoga app, Namaste Yoga app, Vibrate Yoga app. One Health emphasizes the importance of understanding and addressing the health challenges that arise at the interface of humans, animals and their shared ecosystem. Current health care systems are being challenged by various disease burdens, that is antimicrobial resistance, non-communicable diseases, mental health disorder, climate and environmental health communicable diseases, pandemics, post-pandemic condition. To combat the challenges of health care system, traditional medicine can be a significant tool as the local population frequently perceive it as more readily available, more economical, more acceptable healthcare system with an option that balances curative services with preventive, promotive and rehabilitative care. I congratulate Indonesia, who is the current chair of ASEAN and convey my best wishes to them. The Conference on Traditional Medicine between India and ASEAN countries provide a platform to deliberate on various dimensions of traditional system of medicine for attaining sustainable development goals and strategizing on modalities for advancing traditional medicine system. India and ASEAN countries recognize the potential of traditional medicine in promoting health and well-being. They can learn from each other's best practices in traditional medicine. Further, sharing experiences on regulatory framework, quality control measures, and integration of traditional medicine into healthcare system can help improve standard and effectiveness. Collaborative efforts between traditional medicine practitioners, healthcare professionals, policymakers, and communities are crucial to harness the potential of traditional medicine in achieving sustainable development goals, universal health coverage, and advancing global health and well-being. India, under the dynamic leadership of Honorable Prime Minister Narendra Modi ji, believes in the principle of Vasudhaiva Kutumbakam. Indian traditional system of medicine also believes in the said principle, since all the beings are made of 5 elements. Thus, traditional system of medicine has great potential to play a major role in achieving the aim of One Health. The ASEAN Conference will be another feeder in the said principle to develop Vishwa Bandhutva. Namaste, thank you, Jai Hind.
Thank you, sir. Thank you for your